Okay, this is the patient that we have today with us here, and she has a remaining root in the maxillary left, number 26. After making the configuration of the magnification factor in the panoramic X-ray, we found out that this will be around 8 millimeter. It is around 10 millimeter in length from the bone level, crestal bone level area to the sinus, floor of the sinus here, around 10 millimeter. So we're going to place an 8 millimeter mood implant level, and we're going to place some bone graft in the sockets of the extracted roots. The patient had placed other implants before, but today we're going to place for her the mood implant, and hopefully we are going to see this surgery very nicely in the movie. Okay, we have a remaining root of maxillary left number 6, tooth number 26, and we are going to extract these remaining roots, the 3 remaining roots, and immediately place an implant. You can see with the mirror around 8 to 10 millimeter long rapid mood implant. I'm going to extract these remaining roots first, very carefully like we always do. So with the peritone, we will cut the periodontal ligament. Suction, please. By the end of the year, 2016, December. Please sit down. Very nice instrument to relieve all the periodontal ligaments of all the roots, around all the roots, and it will work very nice. Since we have a root canal treated, remaining roots, they are root canal treated, we will try and we have the root now coming in one piece. I'm going to remove now the other 2, being very careful when we are extracting about the bone. Look how I'm supporting both ends, buccal and palatal aspects. This is This is now the site after extraction, after extracting the 3 roots. Okay. Nice. Good. Now give me the smaller one, please, Hisham. Oh, this is the smallest. Okay. Nisha, we will take depth gauge and take an X-ray with the depth gauge, please. من أماكن الساينسز هذا compared to the. اوكي مدام اصبعك بس امسكي لي هذه هنا. خليك لا تتحركي. Okay, now we're about to we have the palatal canal is in the sinus, yet it is surrounded by bone. It is not open sinus, not yet. So I'm going to go in between, putting an 8 millimeter implant in a 5.3 diameter. In a 5.3 diameter. This is the rapid implant.
It's level.
Level. It's a level implant. So we're going to place it in the middle. I am not removing that tissue which is hanging from the palatal area, because I'm going to use it when I close on the implant, because I'm going to put some bone graft. Because this is immediate flapless implantology, extraction and placing an implant. Because it is an immediate flaplet without any flap, we're doing it, extraction and immediate implantation. So we have to consider the tissue size, which is around 1 to 1.5 millimeter thickness. So when I'm drilling an 8 millimeter implant, we are drilling an 8 millimeter implant, yet we have to drill an extra 1.5 to 2 millimeter extra. So the tissue will be up to here. So I'm drilling all the way to size 10 instead of 8, because we have tissue of 1 to 1.5 to 2 millimeter in thickness. This is 4.1, Hisham? Okay. Sometimes I go only slight with this, not all the way to the depth, since it's a self-tapping implant. Okay. Notice I didn't go all the way with this drill. I just went. No need for countersink. This is immediate implantation. This is a level implant, 5.38 millimeter. We're placing it in an immediate extraction site. So. We are very nicely. Austin, please. Austin. I'm gonna show you what nice rigidity we have and how nicely stable is the implant inside the patient mouth. It's more than, I'm expecting more than 45 Newton of the implant stability quotient. The torque was so strong. I am very happy with the stability and the retention in the socket. We're going to check the quotient of stability now. stability quotient, ISQ, using the Ostel instrument. Okay, this is the Ostel instrument measuring the stability of 51. This is really great. I am very happy with this number. It's more than 45 as I expected, and from the buccal it is 49. Okay, so again from the mesial 52, it's even showing from a different angle. Okay, and from the buccal you can see it is 49. This is amazingly nice, and what I'm going to do now is place little bone graft on around the sockets of the extracted roots. Very minimal bone. I'm not going to use any plasma or anything. It's not required. This is an immediate extraction, immediate implantation. The patient has a nice stability, and we'll wait around 2.5-3 months. Yes. Condenser, please. Oh, give me the closure screw first, sorry. Closure screw. This is Genji gel. I like to use Genji gel as a lubricant and at the same time as a growth factor. It helps. افتحي. Okay, condenser. And now hold this please here also. In some schools of thought, they don't like to put any bone graft. They just suture around the on top of the implant, and they leave the sockets to heal on themselves. The bone osteoinduction and osteoconduction will take place, and the reparative bone formation inside the sockets automatically. We have a sterile gauze, and then we dry a little bit the area from the blood. افتحي دكتور. I'm removing this tissue that I told you about when we were suture, and we are ready to suture. Okay. Surgery went really nice. I'm very happy that it went very smooth, and there was immediate implantation after extraction of the 3 remaining roots from tooth number 2-6. If I said 1-6 at the beginning, I'm not sure, but I think I said 2-6. Left area, first more. This is a bit loose, but anyways, I'll just keep it too. And now that after I made sure that this piece that is افتحي دكتورة شوي. I am now suturing that piece that was dangling from the palatal side. I'm making sure it is stable and it is sutured from above the implant. Nice. It acts like a cover, another protection. Added protection. Okay, thank you. Last. Suture in place from the distal. Saliva ejected. No, it was cut, sorry. Saliva ejected. Okay. Congratulations. Well done. I like to keep some Genji gel around the socket and around the sutures, around the implant. It's really nice. Hyaluronic acid. This is hyaluronic acid in commercial use. We're using Genji gel. Hyaluronic acid, 0.8%. It's a periodontal gel. It's very nice in implants. I use it always in oral surgery extraction sites. Thank you very much, Dr. Hamid. This is the implant. You can see how nice it is inserted. And look at, this is the sinus. Here is the sinus line. And we are above the sinus within 1.5–2 millimeter away from the sinus. This is the level implant, mood implant, and 8 millimeter in length, diameter 5.3. We have placed this level mood implant in an immediate extraction, immediate implantation with some bone graft, and the implant stability quotient was very nice, amazing. It was 51 and 49 from the buccal side. We will wait for 1 week until we remove the sutures. I recall the patient after 24 hours or sometimes 48 hours, 2 days, and then I check, I irrigate, I try to keep it clean. I give some instructions. Patients sometimes from their point of view, it's something maybe they're not experiencing, the swelling that they will be facing because of the implant, the new implant, and maybe the bone graft. That's a more major cause of the swelling. And then we wait for 4.5 months, 4 months, 4.5 months, since we have bone graft and it's an implant in the maxillary area. After that, we recall the patient for exposure, second stage surgery, and then we wait until we make the impression and place the crown. Everything okay?